Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing COPD. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. Okay, so what is COPD? So it's chronic obstructive pulmonary disease. It's an umbrella term used for one or more of the following conditions: emphysema, chronic bronchitis, and refractory asthma. So what is emphysema? So it's damage to your lungs, alveolar sacs. So you have little air sacs, and it's almost in a pod like this, and there's a bunch of little alveolar sacs inside of it. Now, what happens is they merge together and form a giant sac. Now, what happens is your blood is getting less oxygen because it doesn't have all these little sacs transferring oxygen. It's just this one large sac. So you transfer less oxygen to your blood. It can also make the lungs stretch out and lose their springiness. And when that happens, air can get trapped in the lungs and it makes you feel out of breath, okay? Chronic bronchitis. This is if you have a cough, shortness of breath, and mucus that lingers at least 3 months for 2 years in a row. Okay, that means you have chronic bronchitis. Now you have these hair-like fibers, cilia, in your bronchial tubes, and it helps move mucus out. When you have chronic bronchitis, you lose this cilia. Okay, so it's really hard to get the mucus to move out. Okay, it makes you cough more. Now, refractory asthma. This may also be called non-reversible. It doesn't respond to normal asthma medications. So what causes COPD? So really, it's irritants to your lungs are the most common causes. So smoking, tobacco smoke, even secondhand smoke does play a role. Also your odds if you smoke and have asthma, obviously your risk factors go up, and you tend to get it a lot faster. You might also develop COPD if you're exposed to things like dust, air pollution, or certain chemicals for long periods of time. Now your age also can make COPD more likely. It develops slowly over the years. And most of the time people are over the age of 40 when they develop symptoms. So it is a lot more rare in the younger generations, but genes can also put you at higher risk of COPD. So what are the symptoms? So at first you may not experience really any symptoms, but as time goes on, they gradually get worse, okay? So a cough that doesn't go away, coughing up lots of mucus, shortness of breath, especially during physical activity, wheezing, squeaking when you breathe, tightness in your chest, frequent colds or flu, blue fingernails, okay? So your oxygen isn't getting to your limbs properly, low energy, losing weight without trying, swollen ankles, feet, or legs. So diagnosing this and other tests. So your doctor will begin by asking you your symptoms, your medical history, whether you smoke or been exposed to chemicals, dust, smoke at the workplace. You'll also do a physical exam and breathing tests, okay? Let them know if you have an ongoing cough. Most common test is called spirometry, okay? You'll breathe into a large flexible tube, which is connected to a machine. It just really tells you how much air your lungs can hold and how fast you can exhale, okay? Now, there are other tests that your doctor may order to rule out lung problems, such as asthma or heart failure. So they can order lung function tests, chest x-rays, CT scans, arterial blood gases, and then just other laboratory blood work. So what are some treatments for COPD? So there is actually no cure. So treatment is really to ease the symptoms and slow the disease. The doctor will want to prevent or treat any complications and improve your overall quality of health. Okay, so the best thing that you can do for COPD is remove what was causing it. Okay, so if you're smoking, if you're being around secondhand smoke, is it a workplace, chemicals? Okay, you want to not be around those things. Okay. So you can talk to your doctor, try different things. Now, medical treatment includes bronchodilators. So you inhale these medications, they open up your airway. Corticosteroids, they reduce airway inflammation. They have combination inhalers that have the steroids and bronchodilators in it. Antibiotics to fight any bacterial infections. There are medications to prevent flare-ups, flu and pneumonia vaccines, pulmonary rehabilitation. So that's including exercise programs, disease management, and counseling to help you stay as healthy as you can. They also have oxygen therapy. It may be needed for shortness of breath to protect vital organs and just enhance your quality of life. When you're really low on oxygen in your body, you're super, super tired. Now, in severe cases of COPD, your doctor may suggest surgery. Okay, so there are 3 different surgeries that they may do. A bulectomy. It removes bulli, so large air sacs that form when the air sacs collapse. Okay, there is a lung volume reduction surgery. So this removes diseased lung tissue. A lung transplant. So it replaces diseased lung with a healthy one. Okay, so those are the different surgeries. So complications of COPD. Respiratory infections, you are at higher risk of getting colds, flus, pneumonia. Heart problems, COPD does increase your risk of heart disease. Lung cancer, so people with COPD are more likely to get lung cancer. Now, quitting smoking obviously can help, but those are the risk factors. So it kind of goes hand in hand. Smoking causes cancer, smoking causes COPD, so it all links together. High blood pressure in lung arteries. So COPD may raise blood pressure in the arteries that bring blood to your lungs. It's called pulmonary hypertension. Depression. So when we can't breathe properly, it stops us from doing things that we enjoy sometimes. So people with COPD do tend to get depressed. Okay, so if that's the case for you, make sure that you're talking to your doctor about that. So controlling your flare-up. So there will be times where your symptoms tend to flare up. So it may be for days or weeks. So you may notice that you're coughing more, have more mucus, you're having more trouble breathing. This is called an acute exacerbation. Okay. So if you don't treat it, it can lead to lung failure. Okay, so the doctor will probably put you on things like antibiotics or steroids. They can help, also oxygen treatment. Now, when you're better, your doctor will tell you how to prevent flare-ups. Okay, so quitting smoking, taking inhaled steroids, long-acting bronchodilators or other medications. Get your yearly flu shot, vaccines, and then just avoiding air pollutants as much as possible, okay? Because those can make your symptoms worse and put you into the acute flare-up. So tracking your COPD diet and treatments, okay? So this can help recognize symptoms that you're having quite quickly, okay? Because sometimes we're sitting there and it's like, okay, I had mucus yesterday, but it's a little bit worse and you're kind of iffy about it. So just tracking it daily can really, really help. And then it can help you seek out medical attention a lot quicker. So you want to monitor your symptoms, diet, and daily exercise by keeping a written log. I love to use a scale of 0 to 10. Okay, so where are you sitting? 10 being the worst for any symptoms that you're having. Okay, so coughing or mucus. Where are you at on that scale? You can really use that scale for anything. I personally love it because it gives you a good range of where you're at. So like 0 would be like no mucus today, and then 10 is like, okay, like a lot, worst it's ever been. Okay. Once again, it allows you to seek treatment in early treatment, and it is most effective at that point. Okay. It's very important to follow a healthy, well-balanced diet, preventing you from being overweight. Now, being overweight, it's going to make your breathing worse. Now, being underweight, it also links to poor outcome. Okay, so you want to make sure that you're eating good quality food, optimizing the nutrition in your food. I always suggest eating from the outside of the grocery store. Okay, so what do I mean by that? You have your aisles, and then you have the outer part of the grocery store. The outer part of the grocery store is always your healthiest foods. Anything on the shelves has lots of preservatives in them. Okay, it's always healthier to eat around the outside, most natural foods. Okay. And then just log your symptoms, your cough, shortness of breath, increase in mucus, fatigue, medications, diet, exercise. Okay, just have a diary and be monitoring that daily. So when should you call 911 or get medical help right away? So there are cases when this happens. So if you have severe shortness of breath, you can't talk or walk, if your heart is beating really fast or beating uneven, if your lips or fingernails are turning blue, okay? If you're breathing really fast and hard, even when you're taking medications, you need to seek medical help right away. So I hope this video did give you a better idea of COPD, but that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now.